When a patient comes in for evaluation at the Bladder and Pelvic Health Center, she could be seen by any of a number of physicians or providers at Lifestages. The Women's Center for Bladder and Pelvic Health is needed because there's a great need out there for women who have urinary difficulties or problems with their pelvic organs starting to fall or slip out, and a lot of women who have pain or difficulty with urinating in some aspect. Urinary incontinence can be divided into two main types. One is called urge or frequency that affects the patient's life. They may not even leak with those, just simply feeling a strong need to go to the bathroom or going to the bathroom quite frequently, every 30 minutes to an hour. This can affect a woman's life to a great degree and make it so that even going out is a difficult problem. Another aspect of urinary incontinence is leaking with coughing or sneezing, and this can cause a woman also to limit her activities, whether it's playing with her children or grandchildren, or her own athletic activities such as tennis or any other running, any other physical activities that she enjoys. The phrase pelvic organ prolapse we use as a general term to describe when a woman has some of her pelvic organs beginning to fall out. They don't necessarily have to come all the way out of her vagina. They can just drop down within her vagina enough that it causes a great deal of discomfort. It can be her rectum pushing on her vagina, it can be her bladder pushing on her vagina, or her uterus. And if she's had a hysterectomy, it can be the top of her vagina that's bulging down. The common symptoms for this are pressure when they're sitting, discomfort if they're on their feet or standing for a while, or even noticing a bulge, particularly when showering. Some women experience difficult with intercourse, and another common complaint I hear is it feels as if they're sitting on a ball when they go to sit down. They can actually feel it rise up within them. And those are some of the more common symptoms from that. Painful bladder syndrome is a condition where women feel a great need to urinate frequently and have a strong need to urinate frequently, and it's oftentimes associated with pain or discomfort right where their bladder is, right above their pelvis, right in the midline. This can begin to dominate their day and their lifestyle, to cause them to go to the bathroom a lot and to experience that pain with it. We have staff with a great deal of experience in this area, where, including myself, have received specialized training in the female pelvic floor with the multiple conditions that can affect it. Our physical therapist has received special training and is continuing to receive more training on treating these disorders from a physical therapy standpoint and a behavioral standpoint. Our dietitian has done extensive research into furthering herself with familiarity on these various conditions and how best to treat them. Our nurses, who have been OBGYN nurses for quite a number of years, have taken a special interest in this and assisting us with the patients when they call in or when they come in and begin to have questions about various diagnostic or treatment modalities that we use. One of the key things for women to realize is that these problems are very common, but there is treatment for them. It does take some effort at times to figure out exactly what's going on with multiple testing, but by the end of it, we usually figure out exactly what's going on, and we have multiple ways of treating it, whether it be through diet, physical therapy, or surgery. We can help most every woman that comes in.